What are my lens options? You have been diagnosed with cataracts and need surgery to correct your vision. As with any surgery, this may feel unsettling or scary. Fortunately, having cataract surgery is a unique opportunity to not only improve your cloudy vision, but also treat other eye conditions such as astigmatism and presbyopia, or farsightedness. After your cataract procedure, you may even be able to reduce your dependency on glasses. Cataract surgery is very safe. It usually lasts just 15 minutes and is typically performed as an outpatient procedure. You'll be given a local anesthetic in the form of drops to numb your eye and will be fully awake during the procedure. There are 3 steps in cataract surgery: accessing the cataract, removing the cataract, and implanting your new lens. In the last step, your new lens will be implanted into your eye, and you will soon have clear, cataract-free vision. You have an important decision to make when it comes to the type of lens implanted into your eye. This lens will likely be permanent and image your vision for the rest of your life. There are a variety of eye lenses designed for different conditions and lifestyles, and each is built to help your vision remain clear and sharp over time. A monofocal lens, the most basic type of lens, helps you see far away, so you may only need your glasses to focus on objects at intermediate or near distances. An advanced lens provides a continuous range of vision that allows you to focus from far distances through near distances and may reduce your dependence on glasses. The design of the lens gives you a high-quality vision in all lighting conditions. Cataract surgery is typically performed once in a lifetime, so it is important to make an informative decision on your surgery and lens. Talk to your doctor to learn more about your cataract surgery options.